Hello everyone, my name is Kelvin Raymond Muniz from Morehead University, Bachelor of Physiotherapy Department. Today we're going to talk about the trochanteric attachment in anatomy model. Think of this greater trochanter is not just a bony bump, but as the powerhouse of hip stability located on the proximal lateral aspect of the femur. It is arguably the most important landmark for both physical examination and functional movement in pelvic region. The proximal femur. The proximal femur, here you see the greater and lesser trochanter. These are the major bone prominence of the proximal femur, serving as a critical anchor for locomotory muscles. This is the greater trochanter and this one is the lesser trochanter. Greater trochanter is a large lateral quadrangular projection, while the lesser trochanter is a conical posterior medial projection at the base of the neck. These both are linked by the intercentric line anteriorly and crest posteriorly. Greater trochanter facets. Superior border. The insertion sites for the piriformis muscle, the crucial for external rotation and stabilization. In lateral surface, away from the body, the main attachment is for gluteus medius. It's essential for pelvic stability during the gait, while in the arterial surface holds as gluteus minimus for insertion, assisting in internal rotation and abduction. Gluteal anchors. The gluteus medius and minimus are the rotator's cuff of the hip. They attach to different facets of greater trochanter to provide multidirectional stability. Also, here, this greater trochanter, it has different clinical relevance. In clinic, it is a vertical landmark. We use it to measure leg length, disparity as guide for surgical access. However, it's also a common site for pathology. You will frequently encounter patients with greater trochanteric pain syndrome, GTPS. This often involves inflammation of trochanteric bursa or tendinopathy of the gluteal insertion. Understanding the anatomy here is the first step in differentiating between simple bursitis and more complex tendon tears. Conclusionally, the greater trochanter is insertion of high force muscle mechanics and frequent clinical pathology. Mastering its palpation and understanding the tension force acting upon is essential for any successful physiotherapy assessment. Thank you. These are my email sources and also my references. Thank you much for listening. We'll come back again. Thank you.